you can edit it out, clip it and stuff. So I guess we're going to introduce ourselves.
Hello.
Hello.
Should I go first?
You turned it on and now I got nervous.
I know.
Like, we just sat here and talked for half an hour.
Hello, everyone. Okay. All right, let's loosen up.
Yeah. I think we should leave all of this in.
Should we?
I think we should leave it all in.
Okay.
Look, this is raw, unfiltered conversations between Norman and Claire. We were going to call it Between Two Lamps.
Mm-hmm.
You know.
You don't see the lamps.
You don't see the lamps, but this room is filled with lamps.
Uh-huh. Okay, Norm, introduce yourself.
Okay, I'm Norman, and I am an LPC here in Baton Rouge, and my area of focus is adult survivors of childhood trauma, which is saying a lot. We will unpack in due course, but
yes.
I'm at the Center for Emotional Healing, which is here in Mid-City, Baton Rouge, and yeah, that's a pretty good. We'll stop there. Okay.
Yeah.
Claire.
That's one of very many hats. I am Claire Cantro, and I'm a physical therapist who I often say has an identity crisis. And I remember one time telling my friend Norm during COVID that I was jumping ship and I was going to go get a degree in, like, you know, become a mental health practitioner. And he was like, maybe just take one course and see how it goes. And I didn't even do that. So, but if I had a kind of a niche practice, it would be in managing patients with more complex chronic pain conditions. So I generally get a lot of referrals or people who maybe did not get well in the normal model, you know, in physical therapy, or have some condition that requires more of a maintenance wellness approach as opposed to a really aggressive 6 weeks in a PT clinic kind of thing. So that is me.
So who are you? What are you guys doing? You just lurking, or
is anyone out there?
Drop in the comments why you're watching this. So what are we here for?
So I think there is a lot of things that we're here for, but specifically what we are launching with these Monday noontime videos is an effort to start having honest conversations about pain, and trying to break down a very complex topic, and creating a narrative that is palatable for anyone and everyone in an effort to lower the threat value of pain. So trying to give people an understanding of what their body is doing and why they have pain. And the more we understand that, the lesser that pain experience sort of affects us on the regular.
Yeah. And so you say threat value. What does that mean? What's the threat value?
Okay, so when we, and I think one of the ways that Norman and I have connected on a deeper level, and sort of like what we've realized that we both do in two separate professions and disciplines, is the root of everything is our nervous system, and is nervous system regulation, and what a good safe nervous system looks like, and what one that is dysregulated, unsafe, all of that. And so in the pain science world, we're trying to change the thought process that pain equals something happening in the tissue, or that it only equals something happening in the tissue. And that whatever's happening in the area that we have pain, that message that's going to the brain is not a message that says there's pain in your arm. The message is there's something potentially threatening, right? Like, and that's generally what sensory processing is. The fact that the way we're alive is that our body is receiving messages from our environment, so externally and internally. and the brain is taking those messages and deciding what to do with them.
Wow.
Some of them are, we don't need, they're benign, we don't need to know,
Yeah.
you know. Some of them are more important. Hey, it's a little bit chillier outside, go grab your coat. I mean, you know, and those are benign, right? And then in other ways, you know, when there's a part of that nervous system, that sensory processing that's activated because there's a potential threat. So something happening in my tissue feels not benign, maybe a little bit more noxious, maybe a little bit more intense, then part of our nervous system is going to activate and be like, the message will be, there's a potential threat here. And then the brain has to say, nah, we've been here before, or, oh, that is a threat, we need to do something about it.
And the doing something about it, does that mean inflammation?
Yes, so inflammation is one huge part of that. We talk about the pain, what's activated in our like pain experience is multi-system. So it's not just that all of a sudden you're going to start feeling pain. That is important, and it's important to us because when we're suffering in pain, that's the loudest thing, right? But what we also don't understand, the multi-system things that are happening to combat the threat. So like if in a very simple, I roll my ankle, right? And there's messages that come in, you know, and those messages are not like pain in your ankle, or it's sort of like, hey, we got stretched a little bit further than is normal. Is this okay, right? Or whatnot. And the brain clicks on and says, no, that's not okay. We're going to create this immune response as well, which the first part of the immune response is inflammation, because inflammation is healing. Chronic inflammation or unregulated inflammation is problem, is disease, and it's you know, orthopedic pain, musculoskeletal pain, those things that so there's there's also the activation of our neuroendocrine system. So if it is a threat that I need to get away from, then I'm going to turn on that fight or flight response. So I'm getting the like adrenaline dumping, the cortisol activation. So it is way more than just some sensory experience.
Yeah, pain is way more than just some sensory experience. And so it almost sounds like there's two parts of pain. There's the response, or the stimulus of, uh-oh, something happened.
Right.
Is this dangerous? Do we need to worry about this? And the answer could be, you know, if we're doing a flow chart,
right?
No, don't worry about it. And then there's no response.
Sure.
Or it could be, yeah, we need to worry about this. And then there's a multi-systemic response. It's going across our vascular system, our neuroendocrine system, you know, our muscular system. Like we're responding in lots of ways that we're not saying, okay, let me respond this way, check. Let me respond this way. Our brain's just doing that.
Right. Okay. And the fact that we're all unique individuals with a nervous system history, meaning that if I am super stressed out about something work related or home related, and my nervous system is ramped up a little bit, meaning it's going to respond quicker to things, then my threat response is going to be real active and real ferocious, right? Whereas someone who is maybe in a really calm place, we're safe, we're regulated, we can take a threat and it not turn into a mass. Even if the threat results in a pain experience, we're not associating a whole narrative story with it.
Okay.
Right?
We need to pull up. I have 1,000 more questions, as I'm sure you do. And we want to hear them. We want to talk about them.
Yes.
In the next video and on the oncoming weeks, we're just going to start just talking about these things. And Claire and I were talking for 45 minutes before we turned the camera on, and we were like, hey, we need to turn the camera on. We're running out of time. But like, this is a conversation, and it's collaborative. And I think that one of the ways in which, you know, we are inviting you guys is to share your pain experiences, to share where you're coming from. I mean, I don't think that anybody, particularly in America, is pain-free or knows somebody who is pain-free. Like, we all know people who are in chronic pain if we're not in chronic pain ourselves. And so this is something that we can collaborate around and talk more about. And so next week, meet us here.
See you on Monday.
Between Two Lamps with Norman and Claire.
They're over there. Thank you for tuning in.
Bye.
If anyone's watching.